Alright, continuing with this report on the state of climate services for health as of 2023. We looked at this observed vulnerability and said it's very disparate across the planet, obviously, and here are some projections. So these are CO2 emissions in excess of planetary boundary fair shares, which is 350 ppm. Well, that's a lot of hidden information in there. Planetary boundaries is a concept that was developed maybe 15 years ago, which looks at various things like nitrogen cycle, CO2, biodiversity loss, pollution, and so on, and says if we exceed these limits, then the planet cannot function. It will not be good for us, and so on. And then a fair share is created to stay within the planetary boundaries, because let's say rich countries have emitted a lot of CO2 already, poor countries have not, so they should be allowed to emit some more, while rich countries reduce and even take out some of the CO2, and so on and so forth. So lots of uncertainty there, but nonetheless you know that there are rich countries like US and Canada and Russia, European countries, who have contributed a lot, high amount of contribution to the planetary boundary, exceeding in terms of CO2 emissions, and that then can be related to health outcomes in 2050. So you can see here diarrheal deaths per 100,000. Africa gets hammered, and a lot of the Asian countries do well, do poorly. South America, Central America, and here you have at risk of malaria per 100,000. Again, Africa, even larger regions, based on what happens with these CO2 emissions to temperature, humidity, rainfall, and then sometimes translated to mosquito populations or risk of malaria, and so on and so forth. So uncertainties keep multiplying, so we have to be careful. Heat related deaths per 100,000, some usual suspects, but you can see some higher latitudes may begin to get affected as well, and deaths related to undernutrition per 100,000, again Africa. So Africa, for example, hasn't contributed much at all to exceeding the planetary boundaries on CO2 emissions to stay within the planet. CO2 emissions to stay within the planetary boundaries, but they get hammered in everything in terms of the impacts by 2050. So that's pretty bad news. In terms of adaptations, adaptation of health and health supportive system is urgently needed to prevent rapidly increasing health impacts of climate change. Insufficient preparedness and climate adaptation efforts expose vulnerable health systems to negative impacts of climate change related health hazards. Water and sanitation, hospitals and clinics, pharmaceutical and laboratory production, to distribution pipelines and ambulatory services are examples of health system functions that are at risk of disruption, damage, or destruction from climate related hazards such as flooding and extreme heat. In 2021, only 35% of low or medium human development index countries reported high or very high implementation status for health emergency management within the international health regulations monitoring. Human Development Index is something that tracks per capita income, education, access to energy, education, women's rights, gender equality, various things. Low human or medium HDI just means they are not developed as well, but sometimes they are rich like the Middle East countries, but the HDI can be still low because of various factors. Okay. Without enhanced risk prevention and preparedness in health and across the whole of society at the community level, the loss and damage to facilities and health services will prevent access to health care, lead to the loss of life, and hamper the ability of health systems to further manage the multifaceted risks to health from climate and climate change, such as extreme events and expanding infectious diseases. With the health impacts of climate change rapidly increasing, accelerating health adaptation efforts is urgently needed. With each fraction of a degree heating, With each fraction of a degree of warming, these health risks will continue to increase. Accelerating efforts to limit global mean temperature rise to 1.5 degrees C by 2100 is essential to keep climate change risks within the capacity of health supporting systems to adapt. The most effective measure to reduce vulnerability in the near term are programs that improve public health today and consider the climatic conditions of the future. So there are obviously many specific action items, challenges, investment needs identified in the report as well. Should I do it in the next podcast? This is only 5 minutes, so let's keep going a little bit. Climate and health policy response. What is the message as of 2023? Health protection is a priority for climate policies in almost all countries and requires high quality climate information to better inform decision making. That's a good statement, motherhood statements, but co-developing this kind of information to actually help decision making is very critical, because the scales at which it is required and the urgency with which it is needed is always important in terms of helping decision making. So health engagement score in that regard in nationally determined contributions across countries. So almost all the countries have submitted their plans to the Paris Agreement in terms of nationally determined contributions, where countries promise to reduce their emissions, often in terms of GDP intensity with respect to some baseline like 1990, and they promise to add forests for reducing sources of carbon or offsetting sources of carbon, and mitigation through renewables, and so on and so forth. But it is a long way to go in terms of actually making sure everybody performs these or sticks to the promises made under NDCs and so on. So you can see here health engagement score in NDC. So when you submit a NDC, are you worrying about health impacts and health response, healthcare systems, health policies as well? Well, these are the countries here. Health engagement score is high for a country like India and some countries here in Southeast Asia, but China is somewhere in the lower range. So is Brazil. I think this is Brazil. US is basically missing. They don't even mention it, and Canada is doing somewhat better. African countries are worried about health, and they have put it into their NDCs, and they may need help, financial, technological, information, and so on, to meet their NDCs for increasing their carbon sinks and reducing their carbon emissions and so on. Keeping all that in mind, it's encouraging that countries that are getting affected, especially the continent of Africa, is doing fairly well in terms of submitting NDCs, but paying attention to health as well. The WHO operational framework for climate resilient health systems should serve as a broad guideline for everybody. So it worries about low carbon economies to come about, with climate resilience as one of the major goals. And you are here looking at building blocks of health systems and various circles here. Well, 2 circles. So financing, I've made this not so readable. Governance and leadership and health workforce. You need training for the health workforce, and essential medical packages. Essential medical graduates and technologies, and service delivery through hospitals and so on, as well as financing, of course. And here you need climate information, leadership, and governance, climate smart health, health workforce, assessment of climate and health risks and greenhouse gas emissions, and so on. So health and climate research as well. Not every country can do this, but countries who are able to do it have to share knowledge and technology. So integrated risk monitoring and early warnings and so on, and management of governmental health and health determinants and so on, climate informed health programs and so on. Sorry about that. I can go back and blow up the PDF and make it more readable, but you should go back to the report and make sure you read all these things. But it's more of a guideline, and there is no necessarily they give guidelines, then they give steps, and then they give finance needs and so on. So we'll look at some of those things in the coming podcasts. What is the value of worrying about climate services for health? Obviously, climate information enhances public health prevention strategies and preparedness to save lives, reduce health risks and impacts, and support countries' adaptation and mitigation efforts. Okay, so we'll come back and look at some examples of climate services for health. And as I said at the end, there are large number of case studies that are worth reading, but I'm not going to cover those in my podcast, but you should definitely read those if you're interested in the details and learning about what has worked and what has not worked. We will look here at some barriers and some investment needs, which will give you a sense of what has worked and what has not worked and what needs to work quickly and so on and so forth. Okay, see you in the next podcast.